Okay, so as you guys can see from these notes that were on the previous slide, we want to divide our 30 minutes that we have, or 35, across these 3 questions, and start off by talking about group members' preferences on these different broad-based financing options. So Rick, I'm going to let you sort of guide the discussion a little bit. I'll take some notes and keep track of time.
Thank you, Karen. And if you can go up a little bit, so for folks to know who's here, and I guess Senator Pan is I think not with us, yeah, as Karen said, I'm delighted for this group, and I think in addition to these questions, I mean, Janice, we'll look forward to follow up with you on the point you made about other corporate tax expenditures. So there may be, that's sort of part of the other. And Janice, I don't know if you wanted to start on. It sounds like you have an idea for other, beyond these 5. These 5 were the only ones that I was aware of that could, raise really substantial pieces of revenue.
I can talk about that other piece, and the tax expenditures. There was a bill this year, SB 956, that was to put together a commission to look at tax expenditures to evaluate which things should be ongoing and which things maybe should be sunsetted. And from looking at that, there are a number of tax expenditures which are, things that are tax credits, deductions, exemptions, exclusions that are in the $2 to $3 to $4 billion range. And so some of these are very popular. The state is going to want to keep them. But there are others that I think that, if a commission looked at them, they would be recommended for getting rid of them. So I think that's the tax expenditure piece of it in terms of doing evaluation there. I do think that the cost savings piece of this and coming to some agreement about what that dollar range might look like, it's a big difference if it's 60 billion to if it's 100 billion in savings. It depends on what analysis you look at where you get to. But I think figuring out, it's a little hard to have a discussion about what taxes do you need when you haven't decided yet what the cost of the full system would be based upon figuring out what the cost savings would be. Because any discussion of tax increases is going to make some folks uncomfortable until they understand the full picture of what that gets them. So I would start really analyzing the savings piece so that then if we're looking at these different taxes, we can figure out something that doesn't have to add up to 3 times what we actually need, because we've actually looked at the tax or the cost savings piece at the outset.
Question.
So that's a really good point. And I'm sorry, Will, were you trying to jump in?
Why don't you respond to Janice first, and then I have a question.
Yeah, I was going to actually wait to respond to Janice and was going to give Bill Shao a chance, because I know from an email that he sent that he feels similarly, and I'd be happy, Bill, for you to kind of state your kind of view of this, but then I would like to respond on that cost savings piece. Bill, do you want to jump in here? You might be on mute.
Yeah. Can you hear me now?
Yes, we can. Thank you.
Thanks, Rick. I think really in healthcare financing, the new thoughts, even put out as a policy by WHO, is there are 2 sources. One is savings, the other is new sources. And I wrote that note back to you, say, you only consider one. That's the new sources. And then your oral presentation, you mentioned maybe there's some savings. But first, I think that savings makes what other new sources might be feasible besides knowing how much money you need. You pin down the savings first. Then you tell people, this is where the saving is. Are you willing to then? The way I express it is right now we're paying healthcare, all of us paying healthcare from many pockets. And we want, unified financing will be shifted most likely to one pocket or two pockets. But if you can say in the end, you're actually going to pay out much less, then you convince people to support you. That's why the savings aspect is so important in public relations. I worked in 9 countries. I can tell you that was what gave the most persuasive arguments in other countries adopting single payers. You mean I can save money? Whether I may pay more payroll tax or wealth tax, or whatever it is.
Thank you,
And
Commissioner.
that's why I think we are missing the boat.
Yeah. And
actually, you put forth really a way to present it, make it so unattractive. That's what I object to.
okay, so I appreciate that, Bill.
I object. I like to say your estimation of the savings is really on the low side.
Well, so let me jump in there if I could. And
for decades, you can at least save 10, 15% or more. And for you to save for 3% or 10%, that's really biased.
well, Bill,
And
if I can jump in, Bill.
So I'm really angry. I think it's a biased presentation.
I hear you, and I'm sorry that you're angry. The presentation used a slide that came from work that Christopher Kai and colleagues did. They published this in January. They reviewed 22 estimates that had been made by a whole variety of different groups of single payer proposals, and the median of that in the middle of their chart was 3%, and there were a few studies at 10%. And to Janice, your very good point. I mean, we haven't. There's sort of chicken and egg questions here. What do you do first? We haven't talked about provider payment. We haven't talked about benefits and eligibility. So there are a variety of things that we haven't talked about yet that are kind of coming up that eventually will get to make it more possible to get somewhere closer to an estimate of how much is this whole thing going to cost. I think I can't imagine any scenario in which we estimate, the $800 billion number that you mentioned for the country is 20% of health spending. We can get rid of insurance companies, and we can get rid of a lot of billing people in hospitals, and that will save a bunch of money. It's not going to save 20%. And to get to 20%, we also have to close down a lot of hospitals and get rid of a lot of doctors and get rid of a lot of nurses and get rid of a lot of people in direct patient care. And maybe we'll decide that that's kind of where to go, but it seems pretty unlikely. And so I used the 3 to 10%, which came from Christopher Kai's work. And I mean, he's a big supporter of single payer, as were all the other people who wrote that article.
And we can also use different studies to compile.
Studies.
Okay, Dr.
Excuse me.
Oops. Yeah.
Thank you, Commissioner. Yeah, I do think we need to let Commissioner Lightbourne ask his question and also hear from Don Moltz. Thank you.
Yeah, very simple question. In the tax alternatives you looked at and considered, have you factored in the Prop 98 guarantee effect?
No, I think that to make any of this work, that Prop 98, there would need to be changes to the GAN limit in Prop 98. And we mentioned that, briefly in the environmental report. Yeah, there would have to be broader changes in California budget processes to be able to bring in all of this new revenue. Is that the question you were asking?
Yeah, basically. I mean, because otherwise, I just sort of a little bit like Anthony Wright's comment earlier. This a single payer healthcare system isn't going to be the only demand in the state on tax revenue, and it's just to factor in a sort of a reality base.
Yeah. I mean, I think that the kind of question of whether we have 127 billion currently in employer and employee spending,
right.
And are there political possibilities to kind of move that over to the public side? That's a question for people who are elected to office to answer. Not for me, but it does seem at least potentially possible. It's a little different than just raising a new tax without having an offset.
Should we spend I'm sorry, Rick, go ahead.
Go ahead.
Well, I was going to suggest that with just looking back, so obviously points well taken on the cost savings piece, but any more, especially from Commissioner Molds or anyone else of these tax options, anything else you'd like to weigh in terms of preferences?
Or Commissioner Ross?
Yes, thank you, sorry.
Yeah, I mean, Bob, if you want to go first, knock yourself out, or I can jump in either way. So I will add to the comment made just a minute ago that I do worry that politically, and I hate to revert back to sort of political strategy, but leading with the taxes that you're going to raise is a little bit like leading with one's chin, and that so I mean there are pros and cons to all of these sources. Generally, I think the approach of some sort of blended combination probably makes sense. I think you guys have already done a really nice job of laying out a lot of the main considerations, and Rick in your presentation, I think you did a nice job of identifying potentially regressive taxes that could worsen the problem that California is already a net contributor to the federal government, and we want to be in a position to capture California dollars for delivery of California healthcare and other services like education and housing and so forth. So that's one, and then the other is just there's this kind of elephant in this conversation, which is how we capture the federal dollars that flow to California right now, to Californians right now through federal programs, TRICARE, Medicare, Medicaid, if we're going to have a unified financing system. And I really think that, one, I've said this before, but it's tricky to do that in a way where you don't potentially do harm in the ask. One version of that is block grants. I mean, essentially, we're asking for the money. We're asking for a big check that we would integrate, and that's a fraught ask, obviously. So we just I think we need to have the conversations in tandem. Would point out that it needs to be done. The conversation needs to be done. Needs to take place cautiously. We need to be mindful of who's on the other side of that conversation, what their intentions are, and yeah, those are the kind of main comments.
Thank you, Don. But Bob?
Yeah, can you guys hear me?
Yes, we
Yes.
can now.
Yeah, apologies for not being in video. Yeah, I appreciate the conversation. This is the one where I'm most adaptive and open to learning and hearing how my colleagues think about these things. I think as a general rule, Rick, my thing is you line them up. What's the most progressive to the least regressive, and that's pretty much how I would weigh in. So I'm very much on the progressive, regressive taxation end of things. Of course, you still got to make the math work, and simply abiding by a progressive to regressive approach may not help with the math. So I suspect, as Don mentioned, we're probably going to be stuck with some manner of blended approach, and I'm open to hearing more. The last thing I'll say, and for Bill, this may not be a small group breakout conversation now, but I am intrigued with, given the Vermont experience and what ultimately happened there, whether there was any lesson around the financing, proposed financing, and how it was presented to the public. Vermont experience that could inform or shed some light, cautionary or enlightening or whatever, with this exercise we're going through now. So I just didn't know whether you have from that experience. I know you were closer to that experience than most of us, maybe any of us. But is there something you would sort of try and do this time differently, or never try and do again? Or and I'm sure it's not that simple, but if there was anything to learn from Vermont about how to think about this.
Sure. Later on, yes.
Sorry, Commissioner Shao, I missed you there. Can you repeat that?
Am I willing to share some of the Vermont experience? I said, sure, I would be happy to when other commissioners have a chance to speak.
Thank you. So Rick, are you
Thanks,
muted?
Bill.
Make sure we still have you, Rick.
Yeah, sorry, I
Okay.
didn't mean to be muted. Yeah, Bill, I do look forward to your response to Bob's question. I would like to try to see if we can get a little more input, any input really, on these 5 choices. Don said, some combination, and I think Bob was there as well. Bob, you said more progressive to less progressive. I think the most progressive here is the 5th one, the raise income tax rates for all income brackets. There are a variety of supplementary sources, wealth tax, taxes on people with more than $3 million of income that are even more progressive. They, at any level that I think the legislature might be willing to pass and that might keep wealthy people from fleeing, aren't, at least to the extent I understand it, going to be nearly enough to raise a lot of what's needed. So the broad-based options, I think, the raising income tax rates is the most progressive. It has the difficulty, 2 difficulties. One is, to raise $100 billion, you would need to double current state income tax rates, and that's obviously going to be a very difficult thing to swallow, and would raise some concerns, I think, about people leaving the state. Not clear. Again, to the extent we've got evidence of people don't seem to move around much for differences across states and tax rates, but we don't have an example of a already high income tax state doubling it. So I don't know if that, that's probably the most progressive, but kind of has these other troubles. The gross receipts tax and sales taxes are, I think, the least progressive, and also have the trouble, like the income tax piece, that federal income and payroll taxes would increase a lot.
Rick, this is Don. Forgive me for my ignorance, but can you explain the difference between some of these proposals and a value-added tax of the sort that they use in a lot of European nations?
Not well. I think that the gross receipts.
Sorry, it comes closest. That's what I sort of thought.
Yeah, the gross receipts tax comes closest. Yeah.
Right. Okay. All right. That's helpful. It's sort of a combination of gross receipts and does a gross receipts tax supplant a sales tax?
It
Yes,
could,
right?
but
It probably.
But I think if we were to enact, say, a 2% gross receipts tax, it'd probably be on top of the sales tax.
Okay. Okay.
Yeah.
All right.
And Janice, you had something you wanted to ask or say?
Oh, I was just going to add, in terms of the tax options, I like what was brought up in the broader group in terms of having, a tax on industries that are causing harm to public health. So I think that's something that's worthy of consideration. I think a wealth tax is worthy of consideration. And then in terms of the ones listed here, a sales tax on services is something that's been discussed in the legislature off and on for a very long time, and there are some benefits to that approach. So I think that would be one of the ones that I would look closely at, both in terms of it being something that is potentially justifiable in terms of the benefit it returns, and then it also certainly can provide a sizable amount of money depending upon how it's implemented.
Thank
I
you.
wonder what Janice, you or others, Bob, will everyone think about, or what your reactions are to the payroll taxes or this broad income tax at source.
Mm-hmm.
Can I speak
Good.
about
Yeah,
that?
please.
Please go ahead.
Payroll tax is one which has one problem, that wages usually does not go up with the same rate as the GDP, because portion of our compensation goes for health insurance or pensions. So if you rely on payroll tax, frequently you have to raise your tax rates to keep the program going. This is what we have learned from all the countries in the world. So, but payroll tax has advantage. You can say, I'm going to tax your wages to pay for benefit that you're entitled to. That's not welfare. It's not charity. You paid for it and give people ownership to the, let's say, Medicare for all or any form of universal health insurance California may introduce. So the compromise thing is you only finance a portion of your, let's say, universal health insurance through payroll tax. But then you want to tax the earned income, like capital gains or stock options. And one way, the other tax, which is much better than gross revenue receipt tax, because gross receipt tax, you tax the same product time and time again, as Rick has in his presentation showed. Value-added tax is only the amount of value you added to that product, then you're taxed. And then you can exempt, let's say, food items or essential items from value-added tax. And this is why the European countries And throughout the world, that's a more favorable tax. And so in lieu of this gross receipt tax, I think we should really consider value-added tax besides wealth tax. And in principle, with the amount of money you would need for universal coverage for single payer, even with the savings, you want to use a combination of different sources of revenues.
Mhm.
Commissioner Lightbourne, did you want to contribute? You were muted, I think.
Yeah, I think Commissioner Shao sort of covered my point very well then.
Okay.
Bob, any other contributions from you on this?
No pun, but no value-added contribution here.
Okay. We haven't talked about the broad income, the broad tax at source, which is a little closer to what Bill was suggesting of trying to tax not just wages, but all forms of income, all forms of compensation, including corporate income. I wonder whether there are any reactions to that from folks in the group.
Thumbs up from Commissioner Lightbourne. How about others? Janice? Dr.
Well, I was just going to add a comment. Earlier on when we were talking about the savings and quantifying it, I do think that before we have further discussion, it would be good for, and I'm not an expert on this, I've just done reading, to share the information that we found about what the potential range of cost savings could be, because it's not a really good place to be where, one person puts forward information and another person says, oh, that's totally overblown. So, I just think providing you with the studies that have been done to end up in a place where we at least have a range we can agree on would be worthwhile.
And so maybe want to stay here for just another moment with question 3. So in terms of what additional information you all feel would be helpful for you to better understand these options, and as it relates to financing, I've already captured that it would be helpful to learn about Vermont's lessons learned, more about the potential for cost savings, what that range would be. Are there other sort of seminal questions do you think would be helpful to answer in this process?
I mean, I do think that in addition to looking at the Vermont example, I don't know why we can't look at examples of a few of the countries that got to this place more recently in terms of having a universal financing system and the approach that they took and what was successful, and particularly in terms of how they made that work in terms of demonstrating to the public that it was a financing system that would yield the benefits that were worth the costs.
Mm-hmm.
Yeah, this is Bob. Can you hear me, guys?
Yes.
Yeah, I mean, the only other thought I had back to the earlier full session comment by Commissioner Rupa, I think about the wealth tax and whether we consider the wealth tax inclusive of the income tax, or is it really, should it be called out explicitly? And maybe it should, but that's the one question or suggestion I have is whether, at least when we're talking about income taxes, to be explicit that we're including wealth taxes, or whether we should call wealth tax or wealth tax out on its own.
I think it certainly makes sense to have a wealth tax listed separately, the estimate I've seen is that a 0.4% wealth tax might raise as much as $7 billion. There's some lot of uncertainty about how effective such a tax would actually be. there is, I gather, and I don't know much about this except I've been told there's a, it would take a state constitutional amendment, which obviously much of this will take an amendment to go above a 0.4% tax, but that certainly is a direction to look.
Mm-hmm.
This is Don again. I guess I would put a plug in for maybe rather than identifying particular taxes, to revert back to the principles that you laid out prior to this discussion, which with the amendment about how you articulate the do no harm principle, I think are a really nice set of guiding principles. I think we need to identify what the dollar amount that we need to come up with, obviously, and the need to develop a tax structure that is consistent with principles that are adopted by the commission. But you're going to want input from people who structure taxes for a living. So folks in the Department of Finance and folks in the policy committees in the legislature, and I think it will be helpful and I think less fraught if we do it that way, and we plan on engaging them in identifying sort of how you combine a lot of the sources that have been identified in the proposal, and maybe some that we haven't thought of yet.
Mm-hmm.
Mm-hmm.
Makes a lot of sense.
I see 2 minutes and 20 seconds before we're going to be pushed back into main session. So any final thoughts on tax options, combinations, additional information?
Yeah, particularly the additional information.
Wonderful. And Commissioner Rocco, I see your hand.
For just in terms of the cost savings issue again that I'm apparently harping on, if you look at the health insurance premiums now, you've got admin costs, you've got agent commissions, which should be considered a part of admin costs, but often aren't. You've got the taxes that are paid on premium by the insurers. You've got the profit. I mean, that is a very large percentage. You get to 20% very quickly. So it's just something to think about.
Yeah. So Janice, thank you for the questions, and we'll share more information. We do have pretty good data on, the net cost of health insurers, and it's about 8% of spending. We'll share also this study that I was mentioning, which was done by single payer advocates, that show the median of 22 studies that have estimated 3.5% savings. Those studies tend to estimate that the 8% will go down to 3 or 4%. The bigger, probably administrative savings tend to come from reductions in the number of people working in hospitals and physician offices who are dealing with all these health insurers. And there is substantial money, to save there. But then these studies also, estimate that universal coverage will increase utilization, because you've got currently uninsured people who get insured, and currently underinsured people who are going to use more care when their copays and deductibles go down, benefits get better. So they're kind of trade-offs, and that's how they tend to get to this 3.5% median. Although there are some studies that are estimating 10% savings, and even a couple that are a little bit more, but we'll share that information.
No, and I think we can get down to 3% admin costs. I've spent 9 of the last 10 years regulating the health insurance industry in California and looking at all of their rate filings. So I